I think the thing that has been hardest for Mary is just not being able to do everything she is capable of, especially because she's just unlike some people, one who so much loves to go to school and participate in things. And it's really amazing the way that even despite countless school absences because of appointments or head pain, she is still keeping up with her schoolwork. But if I could change something, it would just be I wouldn't want it to hold her back as much.
I think if I could change anything, it would be the uncertainty and the fear that comes with it. Just like for her to go out with friends and not know how she's going to be feeling, to take medications everywhere she goes with her, to have to think about if her friends know what to do if she has a seizure. I think just seeing the way it impacts her daily life and the decisions that she makes has been hard. And yeah, just the way she's so strong and courageous, but to see how this can knock her body out and keep her from the things that she loves.
That it not be so scary. I mean, when someone has a seizure, they're non-responsive. So if you're not educated on what you need to do, or you see someone and it's confusing and intense and you don't know what to do. So if you had that, at least a little bit of communication while they were enduring what they were going through, I think that would help out the situation a lot.
I'd make it go away.
I would take it away. I would make it so it wasn't there and he didn't have to worry about it. His life. You know.
Oh, really? Well, not to have epilepsy, not to have seizures. They're devastating. My daughter explained it to me, thankfully, because my granddaughter has epilepsy. She's able to help me understand when he has one. She calls it all cylinders are operating at the same time. And they're in the whole body. So that's every part of your body is having a seizure. Every muscle, everything. So she's helped me a lot understand what's happening during a seizure.
The pain, the amount of time it takes away from someone's life.
The fact that she has it, I'd probably change that.
I would just say maybe not make it so scary. Like, I was not expecting that, and I had no idea at the time what to do, especially when she just started bleeding and she didn't remember anything when she woke up. And it was almost like she was on reset. So she would remember, and then maybe 30 seconds later she'd be like, "What? Where am I? Who are you?" And it's like, is this gonna continue? But maybe just some clarification and to make sure that she wouldn't have that again.
I'd take it from him. I'd have it in a heartbeat. I would take it away from him in a heartbeat. I think one of the things that I get sad about is his frustration that he gets with it, and he doesn't know how to explain it. He's 5, so to try to get him to understand what's going on, it has been a troublesome spot for us. So
I love the lemonade.
Oh, obviously I wish he didn't have it, but we're very fortunate that they have him on medication that has controlled it completely, and seems to be really effective and doesn't give him side effects that are problematic. So short of him having the condition removed from him, which would mean that he'd have to have his brain damage also removed, which would be wonderful. But, at this time, it's not having a big negative impact on him.
I guess that if I have kids that they'll have epilepsy, that's a fear that I have for sure.
My biggest fear, I usually try to stay hopeful, and I believe things are getting better and better, but I suppose the worst case scenario would be that, you know, she's in a situation where she has a seizure and there's not somebody there to react to it, or just basically a seizure that she won't recover from.
I think there are two. One is that she'll get really tired and just give up on her dreams and plans, although I don't see that as likely. It comes to mind every now and then. And the other is the more like physical fear of her having a seizure in her sleep and not being able to breathe.
I think my biggest fear is that she will not recover from one of the seizures, or that she'll lose memories or something, or that she is personally affected by every seizure.
My biggest fear is that one day that I'll be home and I would start having a seizure and nobody else will be home.
My biggest fear for him is he has to let go of it, thinking that it will consume the rest of his life. In conversations with doctors, he's been told that as far as epileptic seizures go, his are very manageable, and there's really no better case scenario. I just need him to, you know, feel good about what he's doing to deal with it internally, because I don't have any concerns for him long term other than at present, and other than taking medication to prevent him.
That he will have a seizure while he's driving.
That I have no seizure.
Having seizures even though I'm on the medication, because the only thing they can do is increase the dosage to find the right amount, and it takes time, and it's a experiment for them pretty much.
Whoa.
Well, I'm going to come back this way.
Biggest fear, the last seizure, was so bad, I don't know how he didn't bite his tongue off. So I would say not to have a seizure that severe, because the doctor did tell me, and I didn't know this, and maybe other people don't either. He said that if he has a seizure and he does not get hurt, I don't have to take him to the hospital. I just have to call him, let him know he had one, and he'll increase the medication. And I did not know that. The first two he had, he got hurt, so he would have had to go anyway. But it kind of alleviated a little pressure, because if he has one and he doesn't get hurt, I just wait it out. Try to keep him safe until he comes out of it, and I don't have to take him to emergency and put him through all the stuff that they do, cut his clothes off and put him in trauma team and stuff like that. He can just come out of it and he'll be okay. That was huge.
My biggest fear is having a seizure that it is so bad that it incapacitates me to the point where somebody would have to make a choice of whether I continued on or not. The brain damage that could go along with it. That's probably my biggest fear.
That one day my mom's will change and she will fall when we're not there, or we won't be there to help her, or with my sister that River won't be able to tell that her iron's getting low, or won't be able to tell that she's going to have one and she'll fall, and Dan will be and her husband will be at work, and then she won't be able to get back up.
Having a seizure in front of everybody, that would be bad. It happened, actually. I had a seizure in French class, and my teacher thought I was just, like, messing around, and then she yelled at me to get off the floor. She's so sweet, though. I feel bad saying that. She didn't know. having no one around when it happens and no one being able to take care of her.
Well, I haven't had a seizure in over probably 2 to 3 years, so I am just worried that it's gonna happen again and that I'm gonna be freaking out like, oh my gosh, I can't believe this is happening again. I didn't want it to happen again. Because I kind of just want to have it go away and be gone forever.
My biggest fear is probably to have one if I do become a teacher in front of my class. That's probably my biggest fear, is to have one in front of my kids.
That I'm gonna have another seizure again.
Hurting somebody else.
Just that maybe she would have that seizure again and no one would be there like I was there. And it was actually very lucky that I was there and that I woke up for it and that I saw that this was happening to help her before it escalated. So just maybe to hope that everyone was there for her.
My biggest fear for my son is that he's not going to outgrow it. That's a big fear for me. Of course, there's always the constant fear of what happens if he has one and I'm not around, and what happens if he has one when he's over at a friend's house or whatnot. So I think the biggest fear for me is just, is he going to be able to drive? Is he going to be able to function even if he's going to have this the rest of his life? What is it going to look like? And you always imagine what your child's future looks like. Well, I never in my wildest dreams would I ever think in the last 4 months I'd be navigating this water. I just never thought that this would be something that God would put us through, but here we are, and there's no turning back from it.
I don't know what my biggest concern specifically with that would be, because he's not independent and is unlikely to ever be totally independent. He will always have somebody to make sure he takes his medication and help him out. If he were alone, I would be concerned for his safety if one would occur and he were by himself. It's unlikely that he's going to be in that situation. It's concerning for when we're too old or when we're gone and he's, has to have somebody else take care of him. We hope that will have a really good situation for him, there. But I don't know that it's going to ever get worse. It just is what it is, and we just have to make sure that he sees the doctor and takes his meds.
I want to be a physical therapist, and before I didn't really have any medical conditions that had really impacted my my abilities as much, and so now I can better relate to my potential patients, and I have more of a passion to be a physical therapist now because I have experienced limitation personally. And the main purpose of a physical therapist is to help people so that they no longer have to have limitations in their life. So I'm not allowed to drive currently, which is frustrating because I want to be able to drive to hang out with friends on my own and do things like that. I also was told that I can't go to college immediately. I have to stay home for the first year, so I have to take online classes if they're available. So that's a big change.
I don't know about my plans. I know her plans have changed a lot, especially not being able to drive, not being able to maybe take 1 or 2 of the classes she wanted to her senior year, or even things like going to see fireworks or going to see a new movie coming out that she's been held back from a little bit. But yeah.
I don't think my dreams or plans have changed. I still see her the same. I think if anything, this whole process has made me see her as older and not as the baby sister anymore. And so in that sense, it's helped catch me up to like where she is and come to terms with reality. Yeah, I think plans in terms of like what we do on a daily basis, maybe, but like long term in life, no.
Definitely not.
Well, like I said, joining the National Guard was one of my plan Bs, and I would always have like these thoughts like, oh, I could probably do boxing, or I can do this, I can do that, and people are just like, yeah, you can't do that anymore. And that's kind of rough, for me at least.
Nope.
No. No.
I had wanted to go into the medical field, but I can't deal with hospitals anymore. I mean, I think I've had my fair share of hospitals. So I knew I wanted to help people. So I've decided to go into education because I just want to be able to help people, so like educate kids, and it just really like, I don't know, like I've just been really passionate about schools lately, like, because like when I was going through it, some teachers just didn't understand, and some teachers were really good about it, so I just want to be able to be one of those teachers that were really good about it, about health concerns.
Right now, I'm just trying to get to that first 6-month milestone, which will probably be in the early part of July of this year.
Yes.
It impacted the house we bought. It impacted making sure that, you know, my husband built our laundry room upstairs, that we have one floor, that there's no steps up, you know, on one side, at least one side of the house. Those were all things that we took into account when buying the house that we bought, strictly because of me. I mean, had I been normal, you know, it's not unusual for people to have their laundry room in the basement or have steps up to their house, even if it's a one-story house, or to, you know, have bathrooms or bedrooms upstairs. For me, that's a deal breaker. It's not an option. It's not something I can physically do, handle, or I don't want to put myself at that kind of risk, knowing that that's just an accident waiting to happen for me.
Not much with my mom. With my sister, it's mostly seeing movies or going to concerts. We have to watch for strobe lights.
I haven't played baseball since that. No.
They haven't really impacted them much because, like, they're under control now, so they don't affect me anymore.
It has honestly not impacted my plans for the future.
Well, actually, I'm on my way to becoming a special ed teacher. So it has, not only since I have, like, not necessarily like special needs, but it is in a way, but I have always been, it's going to be a struggle because in class it's hard for me to focus, and I'm always like, oh my gosh, I'm going to have a seizure or something. So, like, going to school sometimes is scary, but it's not going to stop me from doing what I want to do.
It used to, like, in middle school, my friends would always say, oh, you can't go to a high school dance because there's going to be strobe lights, and I would always start freaking out because I love dancing. So, that would kind of, like, make me sad that I couldn't go to, like, concerts, or I still, to this day, can't go to haunted houses because it's just too much for me.
I don't know, because there's other struggles in my life that's preventing me from doing things, so I don't think it's really slowed me down a lot, but there's minor issues.
It hasn't.
No, we continue to do like we do, and we're sisters, and yeah.
Right now, it has certainly driven our decision of where he's going to go to school. Right now, we haven't ultimately made a decision. We live in Springfield, so he could go to Springfield or come with me to Lake. And right now, we are leaning towards sending him to Lake because he'll be closer to me. So as far as his dreams go, I still think he is very much achievable of this. We're very hopeful. Doctors are very hopeful that he'll outgrow it. But the closer that we get to him being able to drive, that's something we'll have to consider. And but as far as him participating in things, he still does swimming, and he wants to do soccer coming up. And so there's certain things that we have been watching out for, but for the most part, I don't think as a whole we're we're positive that he's going to outgrow it. So.
No, not really. They can live normal lives just like everybody else. There has to be some precautions and be careful with certain things. But for the most part, they're living normal lives.
That's sort of an odd question because I would have a totally different answer if you were asking me that about his brain injury. But by the time he had the seizures, it really didn't change the situation or his outlook or his prognosis for life. It was just one more thing in his injury, and it really doesn't affect him at this point. It's the effects of his brain injury that are limiting him.
Not driving is a huge inconvenience because my mom has a job, and so it's hard to get rides places a lot of times. And as a senior, it's hard not being able to drive to friends' houses and to things like that. And so that's been rough for sure.
The biggest inconvenience, I wouldn't say it's been for me, but again, just the fact that she's been held back from a lot of things that she would normally like to do, like watching the new Incredibles movie or going to see fireworks or being able to drive, and just not feeling her best all the time to be able to go out and go to school and do things.
Biggest inconvenience I face, I think just having to think creatively about how to hang out with her, and be more intentional with the time that I spend with her, which is actually a blessing in disguise. We don't really do mindless things. Our time is more valuable together, which is cool. Yeah, I think that's it.
I don't know if I face an inconvenience, but seeing Mary face inconveniences makes me feel them too. So I guess anything that she gets upset about or she can't do, it pulls me back too, and I just want to help her as much as possible.
The biggest inconvenience is, being reminded to take my medication every day sometimes. So.
Making sure he takes his pills.
Yeah, I have to make sure he takes his medicine. But it's not an inconvenience. We have a weak pill holder, and I just look and make sure you didn't take your medicine. I know he hates hearing it, but it's important.
Medicine. I take medicine every day, but I also have the memory issue, so I never remember. I always forget my meds.
Just being limited in what I can and can't do.
I have to go pick up our dinner all the time now. So if we want Gino's pizza or Pogo. You gotta laugh because it's so hard. You just gotta laugh. And at first, when I would go get pizza or something like that, I'd go, you have to go with me. And you have to go and get it. I'll drive you, but you have to go with me. But I've kind of lightened up on that a little bit. But he can't even go get food. He used to run to the grocery store a lot. There'd be milk and bread on the list. And he would say, I'm going to go to the store and get stuff on the list. And I go, okay. Can't do that anymore.
Having your doctor tell you to take an Uber to Akron because you can't drive that far. That's annoying.
Yeah, her driving, not being able to drive us places. Mostly.
Just not being able to do certain things. Like, I haven't been to a concert or anything like that. Not being able to go certain places with her. She, she doesn't go to sports games or anything like that for the most part because the lights.
Having to get my medical card renewed for being allowed to drive.
Just the constant, the jerking, it sucks. I'm constantly twitching my fingers, and sometimes I'll just spaz out. Like, I remember I was at work and I had like a spatula in my hand and it just went it just went flying. I was like, okay. But the biggest complication is definitely my absence seizures. I struggle with those the most because you're just so forgetful. Like, I could be in the middle of a sentence right now and totally just forget what I was talking about, and I don't like that. Like, it just scares me.
I still live at home with my parents at the age of 30 years old.
Hearing loss. I wouldn't say inconvenience towards me. Just maybe constantly worrying that she will have that again and I wouldn't know what to do, or it could be worse. But yeah, I would say it would just be more her having to take the medicine, which really isn't terrible in the scheme of things.
I think right now we worry. My heart worries every day that I drop him off at school, and I think making sure that we have medicines where we need to be. Insurance has been an inconvenience for us. Just fighting with insurance companies on medicine and where we get it. Is it mail order? Can I pick it up at the pharmacy? So I think for us it's been and insurance issues have been difficult. Our insurance through Lake is fantastic, but some insurance companies look at it a little differently. And the bottom line is epilepsy medicine is not like you can just buy it over the counter, and it's a necessity that you have to have. So that's been an inconvenience. And of course, anytime I see him out, especially when he's swimming, no pun intended, I watch him like a hawk, just making sure that he's okay in swimming lessons and he's okay on the playground. And so we've been just a heightened sense of awareness. So
I would say, other than concern for his health and safety, when he would have one, we'd end up at the hospital, and then I would have to stay with him until he could come home again, because he would have to have somebody there who could help him. So basically, you're trapped at the hospital with this other person and whatever you've got on for however long you have to stay, which was usually at least overnight. That wasn't great. Also, it was disconcerting for him because, hospitals are hard to sleep in, and then he'd wake up and think, why am I here? And, but
most people, they just kind of are like, oh, okay. That's usually it. I mean, some are surprised because they're like, oh, I didn't even know. Like, but most people, they just are completely okay with it. It's just an everyday thing.
I think some people have an idea of what that involves with, they can't watch a lot of flashing things, but other people, and everybody thinks of the seizures, but no one really thinks of a lot of the other maybe more minor things or daily things, like just migraines or headaches, or just all the other stuff that affects her day to day.
I think people are surprised when I tell them that my sister has epilepsy. I recently moved, so I'm meeting new friends who don't know my sister. And for them, I think the response is often like pity. And in that sense, like, I appreciate their compassion, but at the same time, while there is a lot to worry about and a lot to think about and to figure out, I also wish that people could just be like, wow, like, how's she doing? And that has been encouraging, that a lot of people will ask how she is, and when they find out, they'll ask me consistently how she is.
Well, actually, in our English class, our English teacher just told us that her son had been diagnosed with epilepsy, and a lot of the class was they didn't know what it meant, and I understand that because that's where I was with it too. And so it was there's a learning curve, so it was more trying to figure out how to handle things and telling her that she could ask us for help if she needed anything, and just a lot of comforting.
They sort of respond in a way that sort of makes light of the situation. Like they try to joke with it, and like that's how they comprehend things mostly. I mean, especially me and my friends. So,
Few people that I've had conversations with, but they're curious and concerned. I don't think it's so much a taboo or feel sorry for you. It's more of a curiosity, which is a good thing in my opinion.
I wouldn't say it's a bad thing. I know a few people that have children that have had epileptic seizures. It's I don't know. They say they're sorry. I don't know. There really isn't a definite reaction that sticks out in my head.
They ask what it is. They don't know what it is. They ask what happens. They ask what it's like. A lot of times, like, my coaches will, like, pull me aside and be like, I've read your papers, like, what is this? Can you explain? So, they usually just ask a lot of questions and just ask what it is.
I don't think they really know what that means. That's my opinion, because until I was exposed to it, I really didn't know what it meant either, and the only way to really know what it means to have epilepsy is to see someone who has a seizure. Unfortunately, it's very hard to explain. I don't think anything on TV even comes close to doing it justice either.
Everybody wants to know how Bob is, and I don't have an answer.
Usually shocked, because I just don't tell people, so they're just like, what?
They ask a lot of, I guess, not any, no question is stupid, but there are a lot of stupid questions that people ask.
They never believe me. It's, yeah.
They don't believe me at first, honestly, they don't, but they, yeah.
They just tell me that they feel sorry, and I'm just like, thanks, but it's part of life, so it doesn't really bother me.
Some people don't know how to respond. They kind of are like, oh, or they're like, what's that? Or some people are like, oh, I had no idea. So then they're like, and then I explain it to them. So they're just like, oh, you do? Or they get kind of freaked out. Some people that I've encountered get freaked out. Where I've been like talking to someone and then I tell them that I had seizures and they're like, oh. And I'm like, is that a bad thing? Like they get all like nervous and I'm like, I'm still fine. Like you obviously had no idea before. So what's the difference if I tell you afterwards? So, but yeah.
They're kind of surprised because I don't really like tell.
A little. It is really hard knowing that like some days I don't remember things because like just my brain wasn't in the right state that day, that like somebody told me something and I just won't remember. Or like it's hard to know that I got a bad grade on a test because my head was like in so much pain that I just wasn't able to focus right. And it's like it's also hard to admit that I have limitations and that I can't do everything that I used to do. So that's embarrassing for myself to know that I'm not everything that I used to be and that I can't do everything that I used to do. So yes, but it's not embarrassing in the way that a lot of people would think that it's embarrassing. I like when I'm having seizures in front of my friends, I'm not like afraid of what they're thinking and afraid of like that they're gonna like make fun of me for it or anything like that. I'm more worried about my safety and I know they are too. So I'm not embarrassed about what it looks like. I'm more embarrassed that I can't do everything that I used to be able to do.
No, I wouldn't say embarrassed exactly. I'm very cautious about what I say. Like when people ask me about my condition, how it makes me feel and all that, everything just sort of falls down and makes me feel like not normal. So, yeah.
I
I don't know, like, I'm not embarrassed. I just sometimes I don't understand. Like, when it was all happening, like, I was mad more than embarrassed. I was mad that it was happening, and, like, I'd have them at school, and so that would make me embarrassed. Like, I just, like, the different ones I've had, like, I don't want to go into depth, because, like, that's not, like, the question you asked, but, like, just, like, being in class and, like, having one is when I'd get embarrassed, or at practices or stuff.
No.
I'm not embarrassed by it, but I don't tell people. I think having known you for all these years, you never knew. It's not something that I draw attention to. It's not something that I tell people about. I don't generally run around telling anybody about any of my health conditions, although they're multiple. I don't tell them about the car accident, just because I don't want to be looked at as different or any different than any other mom or any other person out there in the street. I just want to be able to continue to do what I do and how I like to do it. I want to be able to cook for my children. I want to be able to make everything from scratch. I want to be able to do my canning. I want to be able to sew my quilts. And I don't want people looking at me differently. So I just don't bother to tell them that there's an issue.
I definitely was at first. I didn't want to come to school at all. So.
I mean, when I was younger, I was really embarrassed. Like, I didn't want people to know about it. But now, like, I'm fine with it.
So I'm not that embarrassed, but I can be at times.
I was for a long time. I was, because you feel different even though no one can really tell. Like, you really feel like you're secluded in a way. Because especially when I would have, like, my absence seizures when I was younger, like, I would get in trouble all the time for daydreaming. My teacher thought I was daydreaming and not paying attention in class. But I had no idea what was going on. Like, I was having seizures, and that's the thing with absence seizures. You have no idea they're happening half the time. So, like, I would just feel so out of it, and you're sick all the time, and it's just, like, you miss things, and, like, I can't go to haunted houses. I can't do a lot of things that my friends can do. So, like, when they'd go, I'd be sitting by myself, and I'd be sad. But then you gotta remember, like, but you have so much else to look forward to. And then I couldn't drive for the longest time, but I was lucky. I was able to get my license when I was 18. But, like, sometimes you're just, like, you have that constant fear, is it going to get taken away? Like, am I going to have it when I'm driving? Like, it just takes a lot of emotional toll on you for a long time, and I did have to go to therapy for that, because kids with epilepsy tend to be very depressed because they feel so alone, when in fact a lot of people do struggle with it.
No, not at all.
No.
Not really. I think people need to know that it's worse than you think. Even if people don't have seizures anymore, they're still dealing with pain, and they're still dealing with limitations. Like, in my case, I haven't had a seizure in 3 months, but I still have to abstain from driving, and I have silent seizures, which are seizures that, like, you can't see and aren't, like, full-blown seizures, but it means that my meds aren't entirely working, and so I have dealt with, like, word issues like I just had right there, where I can't think of a word exactly, and memory issues where I can't quite remember something from a couple years ago, a couple weeks ago, or even just, like, that day. So, like, even though people aren't having seizures anymore, that doesn't mean they're not having side effects from epilepsy anymore. So just be aware of that and kind of help them through those sorts of things.
A seizure isn't always just when you see someone on the ground unconscious convulsing. There's a lot more that could be going on. A seizure may not be seen by anybody. It may happen in someone's sleep, and they would never know about it. And also just the other triggers involved and things like that.
I think the biggest thing I wish people were aware of with epilepsy was the triggers, and just being sensitive to that, especially in movies, especially in kids' movies. And then I think the other thing is just The number of people that I've talked to when my sister has a seizure that say, oh, I don't know what to do if someone has a seizure, especially in the teaching field, that's scary to me. And so I think if there were a way like this video to educate people on what to do, that would be good.
That it's not something that should separate the person from doing the things that they want to do.
It's not tough to talk about with somebody. It's not like you can't bring it up in a conversation without hurting somebody's feelings or making people uncomfortable. As long as you talk about it with somebody, people that are diagnosed with it, they'll be fine talking to you about it. They really will.
It doesn't change who people are. It really doesn't. You don't have to look at somebody differently. That's it. That's it in a nutshell.
So I just wish that people would realize it's not an uncommon thing, and I hope someday research buckles down on it and can help everybody.
Well, like, first of all, I wish people knew what it was. Like, I wish they wouldn't ask what it is or ask what it's like. Because it's just too hard to explain, I guess. Like, it's just, there's so much going on, and they ask you what it's about, and, like, you just don't want to go back to it, I guess. So, probably just don't ask about, like, what it is or how it is.
That it's treatable, you can live with it. There are diseases out there that are much, much worse, that they have no cure for. Or the treatment itself will cause as much injury or damage as the disease itself.
That it can come on at any time, at any age. My husband's 63. He just had his first seizure at 62. Never, ever, ever did I think that at 62 he would have a seizure. I didn't know it was not ageless. I thought it was young only.
That they're not all the same. That not everybody's going to fall out on you and goober out their mouth and do the things that people see in the movies when, that it's not all that. That there's so many different types of epilepsy. There's so many different types of symptoms of it. People don't realize that somebody with a twitching hand may be having symptoms of their epilepsy that day. And then they're looking at them and was like, oh, okay. They may not realize that the medication they're on makes them halfway loopy and that they appear like they're drugged that day. And they're not really. It's just the medication changes, different things that doctors try, and it affects everybody differently.
That it's not just having these people fall on the ground and pulsing. That there are many different ways, and just because you don't see it doesn't mean that it's not there.
Like how to cope with it if you see like another person trying or another person having a seizure, don't just stare, actually know how to help them and how to get them to safety when they do need it.
That a lot of people struggle with it and you just don't know it, and there's many different forms of it. A lot of people think, when they think of epilepsy, they just think of the jerking and the going unconscious, when there's probably at least 20 types of epilepsy and seizure disorders, where and a lot of people, if they have one, they have two. Most people have two coinciding. I have absent seizures and JME. So what I want people to know is it's not just the jerking, especially I think teachers, it's not just the jerking. I used to get in trouble for not paying attention, but that's just my absent seizures. And I think that's the most important takeaway, is that there's so many different kinds, so many different signs, so many different effects.
Like I said, more types than just one, or it's not just, oh, I'm shaking, or that kind of stuff.
We can't help it.
You can still be a normal person and have epilepsy. You don't have to have a bunch of other medical problems and have seizures. You can just be a normal person who has seizures.
Just relax when it happens. I know that's hard, but don't jump to the worst scenario, because when she was bleeding, it actually, they aren't quite sure why she was bleeding during it, but they think maybe like it sparked the nosebleed and it was like going. And the way I actually got her situated stopped her from choking on it and could saved her a little bit more time for when the medics did come. So just make sure you're doing all you can for the person, and it's scary, but just ride the wave with them. No, it's going to be okay.
It doesn't change who you are as a person, and you know, I don't want people to treat my son differently. I don't want people to see him as being coddled by this condition. I want people to just appreciate and respect him for who he is, and we're certainly looking at it in terms of respecting the disease itself or the condition itself, and realizing that at any day it could be a good day, at any day it could be a bad day. So just understanding that there's nothing that we could have done differently.
That it's not that uncommon. I think a lot of times people think it's this strange, mysterious disease that turns people into some sort of different. But the fact is, it is common, it is treatable, and it does happen a lot. So, I would say that anyone that experiences that should understand they're not alone. There's millions of people out there with this condition, and everybody's a little bit different, some more extreme than others, but the fact is it's a lot more common than people think.
When I was shortly out of high school and I was working in a bank, we had a customer who had a grand mal seizure in the bank, and I had no idea what was going on with her. And it was scary, and she fell on her face and broke her glasses, and we didn't know who to call, and then we found out later she had a seizure disorder, but no one knew that. And so I think also you hear a lot about how you have to keep people from biting their tongue. That's a bad idea because they'll bite you too. They can't help it, And my son would often throw up afterwards. So they, to know to not leave somebody on their back and to, keep them safe from injuring themselves, and that you don't have to really do anything because you can't make them stop seizing. You just have to keep them safe.
You are a person who has seizures, who has epilepsy, but you are not epileptic. Like, you are epileptic, but you are not defined by your epilepsy. You are you. And though you suffer from it and though you have it, you are only as much of a person and as much as capable as you define yourself as. So you can do as much as you tell yourself you can.
I would advise that someone going through a struggle with epilepsy or a similar medical struggle, I would suggest that they reach out and find other people and talk to other people who are dealing with similar situations to find out in what ways their situation is the same or different, and just learn as much as they can about the situation, whether it be from doctors or experienced people, just to learn as much as they can to help their situation or the situation of a loved one.
I would say for family members, first of all, find people who can support you and love you, but also in that, remember that you can't pour into someone else out of an empty cup. So make sure that you are being filled up and that you're taking care of yourself. Make sure that you're getting rest, and that you're eating, and that you have people that you can talk to. And if you don't, there's always counseling resources and support groups and things like that. Talk to your loved one's doctor about resources there. But also just don't get so caught up in worry that you miss out on the person that's right in front of you. Don't focus so much on asking how they are and how they're feeling that you miss out on who they've always been.
Don't give up hope, and just know that the person or you, if you're going through this, everything will be okay in the end. And I really honestly believe that. And there's going to be ups and there's going to be downs, but I think everything in the end eventually will be just fine.
It is whatever happens, you're still you. You're still the same person even after the diagnosis. It's not going to change you. It's not going to change how people look at you. If they know you really well, they won't think of you any different way.
Talk. Don't keep anything from anybody. It's not something to be caught. It's not something you can avoid. It's not something genetic. It's just something that happens. It's a disorder that affects many people, many more than are let on, and there really doesn't need to be a negative stigma attached to the condition.
To stay patient, as a loved one, as a mother, as a parent, you aren't dealing with merely what they are in their mind. Of course, the question is why, and hopefully there will be answers that you can get answers. And if not, it's just something they have to deal with for the rest of their life. You take a pill for the rest of your life. It's not that big of a deal. Hopefully it works like it has in his case. And just be patient with them, because believe me, it's a lot harder on the person with epilepsy than it is with the person standing on the outside.
Just stay strong. I mean, oh, I'm gonna cry. Like, I know it's hard, and like, you think it's like, why is this happening to me? But like, you just gotta push through it, and like, it will get better. They'll figure out something. You just gotta, yeah. Oh, just keep being strong, I guess. It's rough. It seriously is, but it does get better. I mean, it does.
Listen to your doctor. Do it, what they think is best, because they have your best interest at heart. And a lot of times they they cannot give you an answer. My doctor couldn't give me an answer as to why all of a sudden I'm having seizures. He says it's just something you have to learn to deal with.
I don't know. There's so many things you can do. You need to talk to people. You need to share what you're going through if you can. You need a support group. I pray a lot. Some woman at church told me she takes a Bible and swings it in the front room. I hope she hits Satan. So I'll do that now. I will pick up a Bible and I will start swinging it in the front room, hoping I hit Satan, and be fearless. I just try to be fearless through it all. It was hard.
My advice would be to be strong, to not let it interfere with your daily life as much as possible, to take those days when you're sick and just be sick, and to take the days when you're good and let them be good. It makes a world of difference in your life.
I don't know if maybe it's just me, but remember that certain things can't be done and certain things can be done to stop or help.
Don't settle. Like, if the doctor tells you that like nothing's happening with you, but there is, just keep trying and find a doctor that works for you.
It'll be all right. You will get through it. Don't give up on yourself. Like, choose to be brave and fight through it. It might happen every day for some people, but for other people it might happen like once a year or a couple years from now. So like, don't give up on yourself when you go through those hard times. So yeah.
Find someone else that has a similar situation and really try to connect, because I know I thought I was alone. I thought I was alone for the longest time. And then I found out I had someone else at the school that had it. So we started talking about it. And then I find more people through them. And you really get a sort of a sense of a community when you find someone, because you finally have someone that understands what you're going through.
Be positive and, like, don't let epilepsy be, like, the definition of you. Be your definition of yourself. Don't let epilepsy control your life.
Grass is greener on the other side.
It's probably gonna be like, it's gonna be okay. Like, your seizures are always gonna end.
Just stay positive and know that there are people out there who have had the same issue and situation, and there will be people to help you.
I would first say sorry. I'm sorry that you're going through this. You know, nobody willingly picks to go through this at this point. And I would say with that, just be patient with the process. It's a long process that sometimes could take a while to figure out with medication. And understanding that it's okay to take a break occasionally and just step out, and, you know, not being afraid to have a moment to yourself, because it is a stressful experience when it's your child. You know, there's nothing that we could have done differently, and that's what I kind of look at it when I speak to other people about it, is, you know, if I would talk to somebody else that's newly going through this diagnosis, is you didn't do anything wrong. Just being affirming to that, and going from there, yeah.
Well, I think the important thing is to recognize that there is an issue there, share with your doctors, talk to them, tell them everything, and follow the protocol, because it can be treated and you can live a normal life. Don't ignore it, and certainly don't think that you're different or a freak, because it's very common.
I would say get information, ask questions, make sure that the medical people explain to you what's going on to the best of their ability to do that. The more you understand about it and know how to cope with it, the less scary I think it can be, although it's still scary, because, you know, if they're not controlled and you don't know when one's going to happen, it's worrisome. But you know, make sure you get a good doctor. If you're not happy, talk to somebody else.
Well, when I initially, like, when I had my first seizure, and after we had started that medication, after, like, I stopped having seizures, and so I figured, oh, that's it. And then I had my second seizure, and it was like, oh, okay, I guess, like, I had the second seizure, but now we have this new medication, so this is it. So now it's under control, and so I won't have any more seizures, and after 6 months I'll be able to drive, and my life will be back to normal. But that was definitely not what happened. And, like, after that, I still suffered from migraines daily, which were almost worse than the seizures. And then I started having more seizures, which were not grand mal seizures, but were still seizures, and had debilitating pain still. And I still wasn't able to function normally, because I had to miss a lot of school for my migraines. And so it was really hard that I had to accept that I wasn't back to normal, even though I wasn't having grand mal seizures. Because I just assumed that it was all over, and it wasn't.
My biggest struggle has just been the times when all you can do is sit back and not have the answers, and just be waiting for the doctors to tell you what is going on, or waiting to see if a medicine works or if she will have more seizures. And so I think that would be the hardest part, is just not knowing all the time.
My biggest struggle has been letting go of worry, I think, and just trusting that Mary has really good friends that know how to take care of her, that she has amazing doctors who are trying to figure this all out. And yeah, just letting all the worries go and trust that God knows what he's doing and that I'm not really in control of anything.
Keeping hope. I mean, when you meet a person as good as Mary is, and she's struggling so hard with this, it's really hard to watch. So, keeping hope.
My biggest struggle has been trying to keep a positive mind about it, trying to make myself believe that I'm still a person, I can still do all the things I would love to do, except it just will have to take some more time to do those things because I've had my diagnosis.
Helping him through it, I guess. I mean, on his path, not on my path. Following his lead, I guess.
Oh my gosh, it was just so it was rough. This right after my second surgery, my second brain surgery, I came home. That was when I had no hair, and people came home. I came home. People greeted me, like people from school came, and that was cool. And then I lived with my grandma that whole summer in Talmadge, and not one friend came to visit me.
Seeing how my family deals with it, they call and check on me. They're afraid to leave me alone. Even though I feel fine, it's something that just doesn't go away. It will always be there. That's my understanding of epilepsy.
Girl. Sorry, Hannah. Scared. Scared that he'll have another one. When he'll have it, if he'll have it, won't he have it, will he have it? Then the medication he's on, the side effects of it, they're horrible. Right now they're horrible. And then he makes me mad because he comes in and he says, I'm going to go out, come and watch me, I'm going to snow blow. I said, don't ever ask me that again. Don't ever tell me that again. You are not allowed to snow blow because if he has a seizure, he thinks that it will release and he'll just go down. But it's not that way. When you have a seizure, you're going to grab the bar that has the release on it. You aren't going to release it. So you can't snow blow. No.
My biggest struggle would be to remain normal. My biggest struggle has always been to remain normal, to still have some semblance of normalcy, do what I want to do, and not push myself so far that I send myself to bed for 3 or 4 days.
Mainly people not believing me. Like, I can't do certain things and people don't understand that, so they just kind of ignore the fact. They're like, tell me to quit being a wuss or something. Probably that I'm always worried about her. Like, I'm always thinking, like, oh my gosh, is she with it right now? Is she?
Probably my biggest struggle was, like, telling people about it. Like, I would, before my medicine, like, started working, I would have the seizures in front of people, and they'd be, like, really confused, and I would just kind of be like, oh, like, it was nothing, so.
Probably making my parents worry about me, and because I don't want them to worry, but at the same time I do, but I don't want them to worry too much because, one, my parents have other children, so.
Finding the right medication and trying to find out why I have them, because they have absolutely no idea. And for some people they do know, but some people they never find out. And it's kind of a struggle because you want to find out so you know the cause so you can get to the root of the problem. But right now we still have no idea, and that's kind of been my biggest issue.
Seeing my family, like how they feel when I have a seizure, because they get more freaked out than I think I do sometimes, so.
I'd say school, because those were my growing years, so I'd say school.
The, like, hearing loss part, and yeah.
Probably goes back to the last question, just hoping that she doesn't have it again and that she can keep on this streak she's going and just, yeah, keep living and working like she does.
I think for us, trying to figure out the dosage for the medicine was so frustrating because he would have 3 or 4 solid days where we'd be seizure free, and then he would just hit rock bottom, and then the answer to us was just up his meds, just up one more dose. So at one time we had an upwards of medicines 3 times a day, and that was really frustrating to me. That was the only answer that we were getting. I mean, we get EEGs. No, you don't need one for another 2 years. That's not the answers. And I think for me, the biggest struggle too was kind of like looking at God and saying, why me? Why our family?
I don't know. I think the most stressful things were having to have him taken to the hospital, to call the ambulance, take him to the hospital, go through emergency, wait for him to see him, make sure he was okay. And then they wanted, to do pictures, and they said, well, he's likely to have another seizure while he's out there and you're trying to take a CT of his head. And he did. And, but, when you're in a hospital setting, there's people there to handle that. I don't know.
I have really good friends that help me through it all. They just accept me as I am. They accept that I can't do things and that I'm different than I was, and all my friends are all honors kids, and that's how we all kind of met and grew close. And now I'm not as much as an honor kid as I was because I can't do honors classes as much because my brain just can't take it. And they're all understanding of that. And they're understanding of my limits. My church family has also been a huge help. I haven't been able to make it to church a lot because mornings are just so hard. But they write me notes and write me letters, and they pray for me all the time. My faith has been a huge part. Just knowing that there's still a plan even when I can't see it. And I have, my family's just been amazing. They tell me, even though it's expensive, that it's worth it to take care of me and to make sure that I'm okay. So I just have a huge support system, and it's been great.
I believe to cope with it is just trusting and knowing that, we're finding out more and more, and things can, in a way, only get better, and just believing that things will be okay one day.
So the only way I know how to cope with my sister's epilepsy is just trusting Jesus and that he knows what's going on. I love Psalm 139 that talks about how God knows every little bit of our bodies and created us intentionally, and knowing that he knows her far better than doctors could is really good. And then also just community and friends. I have a Bible study group at church that is consistently praying for her, and friends at work that are consistently asking me how she's doing.
I pray a lot. There's a lot of praying. Sometimes there's a lot of yelling. There's a lot of crying. I mean, emotionally, it's tolling.
I cope with it by just watching TV, talking to my friends, talking to my doctor about it as well. She tells me about all these sort of organizations that will help people with this diagnosis.
Take your medicine every day. I mean, there's not much coping in my mind. Again, helping him with what he needs help with, but I don't view it as overly concerning for his long-term well-being, because it really doesn't need to be.
I just cope. I put my trust somewhere else.
Honestly, it was hard. I just got really depressed, and that probably had a huge factor with the medicines too. I was put on 10 different medicines, so I just was really sad all the time, and I couldn't do any physical things because I was recovering from surgery. So I just sat at home and I watched a lot of Glee, and I lived with my grandparents, and I love my grandparents so much, so I hung out with them a lot. I'd go to the pool. There was like a pool up in Talmadge that we'd go to sometimes. But yeah, I just kind of sat around. Like, now I wish I could go back and change my attitude towards things, because now I'm appreciative of what I've got out of it. But I just was really depressed.
Just go about my normal routine, be aware of my surroundings, even to get on a chair to change a light bulb. I should not be doing that. So I go and get the light bulb and get somebody else and get them a chair and say, I need that light bulb changed.
Not very well, obviously. But we just keep working through it every day. We're good thing we like each other. Because he's criticizing my driving a lot. Telling me which way to go. Telling me to lock my doors. Yeah, so I'm not used to having my passenger tell me how to drive and not drive.
You know, I just don't let it come into my mind daily. I just don't. It's, unless I'm feeling funky that day, I just don't let it even enter my mind.
Mostly me and my siblings and my mom and my sister make jokes about it. It's dark humor. It's the only way.
I just gotta take care of my body, make sure I don't swell, and ice myself a lot. I used to go to counseling for it, and then I was to the point where I didn't need it anymore, so I don't.
I cope with it by just... I personally try to forget that I am diagnosed with it, because if I keep thinking about it, I feel like I'm gonna get myself down and I'm gonna just ruin my life if I keep worrying about it.
Well, I do get sad at times, but what I do is I kind of just sit down and tell myself, you know what? You were born this way for a reason. It's happened to you for a reason. You were meant to go through this. Like, you're strong enough to go through this. That's why you were given the life with epilepsy. You're strong enough to get through it, and like, it's your job to show the world how strong you are and how strong people with epilepsy are.
I used to just tell myself that everything's gonna be okay. The doctors will find out something eventually, and that if I do have a big, huge seizure, that I know that my parents are gonna help me out of it, and that God's gonna help me out of it. That's what my mom always used to tell me. They were like, God's going to be with you, right beside you when you have your seizures, so don't need to worry about it. So
I play video games.
There are some days it's good for me, and there are other days it's bad for me. With that, being able to communicate with good friends, close friends, being able to talk it through my husband, and our parents are both close by too, has been great. Being able to talk to people from our church, and we would not be able to have accomplished where we're at if it wasn't for our church and our friends and people that have been covering us in prayer. And there is no way that we would have been able to even fathom seeing how this would pan out for us. I think at the beginning, when our pediatrician had mentioned it, we're like, this isn't epilepsy. Like, we didn't know anything about it. That we thought epilepsy was convulsing on the floor, and we've seen a few of those from him, but having our friends pray for us and family pray for us has been so refreshing.
Not being able to go to school, not being able to stay at school, not being able to do the things that most other people don't think of, like going to movies and other things that might involve bright flashing lights. I know one thing that was especially hard was not being able to get her license yet. But those are the main things.
My sister isn't able to do a lot of the things that she used to want to do. She can't go see a lot of movies in theaters. She's exhausted all the time. I think that's been the biggest thing. She just doesn't have the energy that she used to have. She's had to go on different diets, and so it's changed like what she's been able to eat even. And just like the whole way of thinking and looking at life. Epilepsy is always in the back of her mind when she thinks about things.
He questions whether or not he's got abilities for certain things, and I think my indication to him is constantly it doesn't have to change anything. You deal with it and you move forward.
I think from my perspective, the medicine makes him extremely tired. I think he feels like he's always sleeping. Doesn't really have time to do what he wants to do because he's so tired all the time. He doesn't have that many seizures, so luckily the medicine's controlling them. But I can't imagine that there isn't a day that goes by that it's not in the back of his head. And what a today is today, you know.
This is hard. He can't drive. We watch our great-grandson. He can't be left alone with him. He can't use a snowblower. He can't mow the grass that he's riding a lawnmower. I can't leave him alone. If I go somewhere, I have someone come and stay with him, like for at least a couple hours out of it. And if somebody's not with him, I call and make sure he's okay. He has to check in with me because if he's had a seizure, we have to walk down and get our mail in our allotment. He can't walk down and get the mail without telling me, because if he'd have a seizure from our house to the mailbox, he'd just be out there and I wouldn't know it. So he has to tell me where he's going, when he's going. You know, he can't go anywhere by himself anymore. You know, it's a whole different change of lifestyle.
She's more careful with certain things. She can't drive at night. That's also because of her night blindness, but also because of seizures. Driving for long periods of time. Mostly just stuff that any epileptic gets taken away from.
Well, she couldn't drive for almost a year. You just have to be very careful with lights and things like that.
She's been able to keep a normal life. She has a great job, and I mean, she definitely has to watch because she had an appointment, I think a year ago, to see if she could get off the pills because she was doing so well, and they still found seizure activity. So just to keep on doing what she does.
Well, we carry a giant Tupperware container of medicine around wherever we go. I think it starts to explain a little bit of his behaviors. A few years ago at preschool, we had a little bit of trouble with his behavior, but I think that was partially due to this condition that we never really were recognizing until now. And so we decided that that we kind of put two and two together and really realized that it was probably due to this. I mean, really an absence seizure is, it's like I can explain, turn a light switch off, wait 15-20 seconds and turn it back on, and he is mid-sentence right where he left off. And so his frustration with that, he gets really confused with it sometimes and just extremely exhausted with it. So we've been working with him to be patient with this, and the doctors are very optimistic that he'll outgrow it.
Well, I kind of grew up with epilepsy. Epilepsy was kind of unknown when I was younger. You know, it was one of those diseases that wasn't really talked about. It was oftentimes misunderstood. The medications weren't where they are today. So it wasn't exactly something that you really talked about much back then.
Other than having to go to the hospital during the year they were trying to find him medication that controlled it, at this point, it does not really affect his life, I don't think. Like I said, he doesn't have side effects from the meds. He hasn't had breakthrough seizures.
My life has changed mainly in that I have a much greater awareness of epilepsy now. Also, just realizing how valuable life is, because you never think that, you know, things like this could happen to you, but you never know what's going to happen. And just being able to empathize and sympathize with people going through similar situations with hospitals and medication and things like that.
For me, it's had, I've had to think through things a lot before I say them. For some reason, I love laser tag, even though I never go. And so when she's like, what should I do with my friends tonight? I'm always like, laser tag! Wait, no, you can't do that, I'm sorry. Or you should go see this movie. Oh, wait, I'm sorry, you can't. Or are you going to that concert? Oh, sorry. And so like rethinking like what my first response is to things. I notice things more often now. So like anytime, one of her triggers is flashing lights. So anytime I see police cars or traffic lights that are flashing, I just automatically get a little anxious and think like, oh, Mary can't be here right now, even if she's an hour away. It's still in my mind. If I post something on social media that has flashing lights, I always text her and let her know like, hey, don't look at my story today. Yeah, I think it's just changed the things that we can do together and has forced me to be a little more creative with how we spend our time.
Oh, a lot, actually. Having a friend that is now diagnosed as epileptic, I've been watching out for flashing lights or watching what time of the day we go out driving and if it's in a woody area because of the light that reflects off of the car window. And it's a lot. I'm a lot more cautious about what I post and what I share and how certain things she responds to. And then I'm more sensitive when I'm showing other people. So I'll be like, are you epileptic? Do you want to watch this video? Will it hurt you in any way? And I'm more cautious.
I find that I have to be more aware and vigilant about helping him with the things that he's dealing with as a result of being epileptic.
There isn't a day that goes by that I don't think, what if today is the day? Or every time he leaves to go driving, I hope that, you know, I've said over and over again, if he does have a seizure while driving, just please let his foot be on the brake, not the gas. But I try not to let it consume me. It really hasn't changed our lives in like a drastic way. We just hope that everything is okay.
It made me very like scared of, like, if my vision would go blurry for a second, like I'd freak out, like, oh my gosh, I think I'm about to have a seizure, you know. But even though, so it was like PTSD basically.
It has changed my life. Well, I never knew anything about the disorder until she had one, and it just makes me more aware of the people who do have this condition and how responsible they have to be and have to be aware of it. And as a teacher, I actually have a student who had to be monitored just in case she would have conscious seizures. She would have a stopwatch that she would give all the teachers, and we would just have to time it and call the clinic immediately. So just kind of just being aware of what it looks like and how I can help them.
When that was happening, it was very, it made us nervous, because even though he didn't have a lot of seizures really frequently, you never knew when one was going to happen. And so especially in the beginning, I was very nervous about, you know, if he were somewhere or driving or whatever, you know, what would we do if he had one in the middle of church or, you know, in the car, or, you know, he never did. But it was a constant, you know, in the back of your mind, you're nervous that it could happen.
That even though you can't do something, it doesn't mean that you're less of a person. It's definitely hard for me to realize that, like, my life isn't what it used to be, and I can't do everything that I used to be able to do, but that doesn't mean I'm less valuable than I was. And I knew that about other people, but I never knew that about myself. So that's been something I learned. My perspective has changed in that, like, I used to just hope for a day with no pain, or a day where they would just find a medicine or something like that, and I would just wait until I could drive and just couldn't wait for those things. And now it's changed that, like, I focus more on myself emotionally, and I look at the good things even though there's pain, and I try to look at every single day as different instead of looking towards the future for hope. I look at all the blessings. Like, if I didn't have the pain and what I'm going through right now, I wouldn't have met the doctor that I have now, and he's a really sweet man. I wouldn't have had all the exciting times in a hospital stay that I had. I wouldn't have met a lot of people who have a similar story as me. I wouldn't have known my teachers were so gracious if I hadn't had this disability. And so I've learned to look at the blessings that have come from this, or the things that I've learned from it, instead of looking at hoping until it changes and goes away. So, yeah.
My perspective on life has changed in that I have a greater value, especially for my sister's life, just knowing that it's not something to be taken for granted, because, you know, if something goes wrong, you wouldn't want to have any regrets. And it's given me a greater awareness for others and how they may deal with epilepsy or other medical issues.
I think having epilepsy in our family has just caused me to be more intentional with spending time with them. Just a reminder that, like, life isn't promised or guaranteed, and that life isn't easy. And a reminder that it's been a good reminder of invisible illnesses and invisible struggles, and just being kind to people because you don't know what they're going through.
Life is short. You can't take it for granted, and life's not always fair. So you gotta roll with the punches.
Was taught to, well, not taught to, it taught me to view people as people, even if they have the diagnosis. Like, I'm not sure about anybody else, but as when I heard somebody has seizures, I'm just like tentative about what my actions are, and like, oh, is this right? Should I do this? Should I do that? But really, we're just normal people. We can take jokes about it. That's the biggest thing.
I know that it's changed it at all. You know, I've stopped and thought about, you know, before he was diagnosed with epilepsy, I don't think I had any preconceived notion or, you know, concern about people that I knew that were epileptic. You know, typically speaking, I heard they were managed, and I didn't spend a lot of time educating myself on the subject. And so knowing that as far as his seizures go versus other ones that people experience, he's at the very easily manageable end of the spectrum versus one it's much more difficult.
I think there'll always be that worry, even as an adult, that he would have a seizure at not a good time. But, like, again, I don't let it consume me. It's not something that, you know, I would not be surprised if it happened, but I'm not letting the worry consume me. Yeah, so.
It's changed. I'm so grateful for everything. I honestly, it changed how I, like, people with epilepsy, I have such a appreciation for, because it's hard. It was hard. It was so hard. It just changed, like, it makes me grateful that I got to go through it, and it made me strong. Yeah, I'm gonna cry. Hold on. It changed a lot.
Not too much. Getting old is no fun. I can vouch for that. But You know, fortunately, I don't have to go to work. If I did have to go to work, I would have to be transported to and from every day. I can't just get in the car and run out and grab a sandwich or something like that. Those limitations, you don't miss them until you can't do them anymore.
It's fleeting. I was always a thankful person, but now, even with my granddaughter, I'm thankful, I feel blessed, and I'm grateful for always just grateful for every moment I have, all the time. When my granddaughter says, "Will you go prom dress shopping with me?" I'm like, heck yeah. You never know whether there'll be another time.
It's made me more determined in my life to do everything that I could possibly can, whether it was the adopting the children, raising children. I always just wanted to be the best I could be at it, despite anything else going on, despite any other health issues or doctors telling you you've got 10 years max, or I was supposed to be in a wheelchair by the time I was 30. I'm not. I refuse to be. In fact, he gave me one and I sold it. I refuse. As long as I can continue to refuse and live my life to the best of my ability, then I'm fulfilling what I believe God put me here to do.
I kind of got to keep an eye out for my family, and if I don't, then I get too anxious. Gotta remember everything and keep it together.
I think it's more my mother having epilepsy. I saw what she went through, so it's very tough for people that go through it, and you got to be more understanding.
Well, it hasn't changed my perspective on life. It just has taught me that everyone has their own medical problems, and every medical problem is different. Like, certain seizures are different for certain people. Like, mine were different. Mine are different from another person's seizures, and they might have to be treated differently, but it hasn't changed my perspective on life. You just keep going on with life, and you get through it.
It's taught me how to be strong. I mean, without if I wasn't strong, I don't know how I'd get through the day, because there's always going to be that constant fear of, oh my gosh, I could have one today, or it's just, but you have to just know, you're going to get through it, you're going to get through the day, take it day by day.
It's opened my eyes for me having, my type of seizures where it's only at night. With Mary's condition, when I heard about it, I just felt so bad. And so, why do I have this type of seizures? Why I was blessed to not have, your type of seizures, and I was blessed in, not being able to have them during the day, so it made me very grateful for what I had, but it also gave me a realization that it could be a lot worse.
I don't really know enough of life without seizures, so I can't compare it.
I don't really know that it has. I think it's made me a little bit stronger as a person.
It has opened my eyes, yeah. I mean, it was very, very, very scary, and it's made me appreciate her more and appreciate my loved ones, and to realize that I'm going to try to do anything I can to help them when I see them hurting, and it's just a hard thing to deal with, but I know we can all get through it if we have each other, so.
Certainly it has made me think differently about, like I said, it is a sucker punch to see people at neurology and kind of just look at it and be like, well, woe is me, and look at it and see how bad I have it. But in reality, it's it's like a blurb on the horizon for us right now, and that's what we're working towards. But I think our perspective on it is just not taking for granted what we have and what God has provided with us, and I mean, he's still my 5-year-old rambunctious kid that's into everything, and it hasn't changed the way that we feel about him. It's not something that we have looked at and said, well, our child is different now. I think he's always been different in his own little way. And I think, people are very inquisitive about it because they don't know much about it. And we were like that at the beginning. We didn't know much about it. So, yeah.
Well, for the most part, anyone with epilepsy is normal just like everybody else. And it's very difficult to know that they're dealing with whatever issues they might have. They might have had a bad night, they might be struggling with medications. So I guess what it's taught me is you never know what other people are dealing with. So it kind of helps you to be a little more thoughtful, gentle in life.
I don't know that his seizures changed much. I think the change happened when he had the brain injury. And obviously everything changes when something like that happens. The seizure disorder compared to that other injury was not much. Yeah. It was just a side effect, sort of.
My name is Ben Kelly, and I filmed and put together this video. On behalf of both me and Mary, we'd each like to thank you for watching this video, and we both hope you learned something about epilepsy or seizure disorder. When Mary approached me and asked me to help her do this project, I really knew nothing about epilepsy. I thought that it was just something that caused seizures, and that seizures were just convulsing. Since then, I've learned so much from being able to sit in and listen on so many stories about epilepsy and hear about so many different cases, and I've really seen how it's not a very cookie-cutter disease. It's different case by case. So because of that, I'd like to share some of the things I learned since I started with knowing nothing. I've learned that there really isn't two conditions of epilepsy that are the same. It really is a different condition for every single person who has it, and even with just seizure disorder. Even down to just the medications you have to take, the types of seizures you have, the types of triggers you have that cause those seizures, or the types of treatments you have to take for the epilepsy and for the seizures. It's just all so different for each person. Through hearing about how people reacted to epilepsy, whether it be friends, family, doctors, or teachers, some people don't take it seriously, and some people become scared of the person who has epilepsy or seizure disorder. And there's really no reason to that, because at the core of it, these people are all still the same. They're still the same person they were before and after their diagnosis. And the only thing that's really changed is that they have to take medicine for it and that they can't do certain things anymore, but that doesn't make them a different person. I've also realized that every one case of this condition affects multiple people. While there's the one person who has to learn how to live with a condition, there's their friends and family who have to learn also how to live with that person. They have to help watch out for the triggers, and they also have to learn how to take care of them before, after, and during their seizures. I've also realized that people generally do not know a lot about epilepsy outside of the people who know someone that has it or have it themselves. And it's not to their fault. The schools and society today doesn't teach us about epilepsy like it does with other conditions. And epilepsy is a common disease. It's every 1 in 26 people. It's something that we should all learn more about, and we should all learn about the triggers and how to care for someone when they have a seizure, because more likely than not, we might come across someone in our life who has this condition, and we need to know how to care for them, and we need to know how to not spread triggers around that could cause seizures. So again, me and Mary would each like to thank you for watching this documentary, and we both hope you walk away from it knowing a little bit more about epilepsy and seizure disorder than you did yesterday.
Yeah, I don't want to get too emotional, but he is just, we've been so blessed with God being able to bring us through this whole process, and I can't speak enough about that, just being able to walk through this arm in arm with God and realizing that he's carrying us too. Knowing that we're hopeful that he'll eventually outgrow this. And he's still our little Jonathan, but he likes to tell me that his name is actually John now because that's what his friends call him. So, but he is a trooper through this whole thing, and we love him through and through for that. So,
just understand the condition, as much education as the family can get, because there's varying degrees of epilepsy. There's varying degrees of intensity. I would say learn what your loved one has, learn what to expect, and don't panic. It's not the end of the world. Stay calm, that's a big part of it, and be understanding.
I mean, just keep pushing. Like, I'm not gonna lie. There's nothing easy about it, and like you're always scared it's gonna happen again. And you're gonna have another seizure. You just gotta keep pushing through it. Be strong, and it gets better. I promise.